Is wearing a face covering over the mouth, otherwise known as a mask, beneficial for preventing transmission and promoting well-being during the COVID-19 crisis? The World Health Organization has shared their guidelines for this year and recommends that wearing medical masks when not indicated may cause unnecessary cost, procurement burden, and create a false sense of security that can lead to neglecting other essential measures. Furthermore, using a mask incorrectly may hamper its effectiveness in reducing risk of transmission. When exactly do they indicate to not wear a mask? It is not indicated if you don't have any symptoms, as there is no evidence on its usefulness. It is also not indicated if you are isolated in your home, even with presenting with respiratory symptoms, but rather should properly cover your nose and mouth when coughing or sneezing and continue to wash your hands. Finally, WHO recommends that if one has to wear a medical mask, appropriate use and disposal is essential to avoid any risk of transmission through improper use, and that those presenting with respiratory symptoms should improve airflow in living spaces by opening windows and doors as much as possible. Most importantly, cloth, cotton, or gauze masks are not recommended under any circumstance. A review published in the journal Influenza and Other Respiratory Conditions found additional non-supporting evidence towards the all-encompassing mask wearing. The U.S. Surgeon General came out on April 13th, warning that mask wearing could increase a person's risk of contracting COVID-19. The same article sheds light on the CDC's recommendations on mask wearing, that only select groups of people should be wearing a medical mask. An additional article states that the CDC also approves the use of cloth masks or face coverings when going out in public, contradictory to the WHO guidelines that you should never wear a cloth face mask. What the CDC and WHO guidelines clearly agree on, despite contradictions in advice, is that individuals presenting with no symptoms should not wear a mask. Wearing a mask will not prevent you from getting sick and may not prevent transmission of infection from spreading. While masks may be recommended only as transmission reduction once you are sick, the associated risk of using masks incorrectly may be more damaging than successfully and consistently preparing your health for any potential concern that could inundate our natural habitat. Furthermore, focusing on personal protective equipment like masks and face coverings will not provide you better health in a crisis situation. What could you do to prevent risk of transmission? Scientists say that fresh air and natural sunlight might be a good start. Sunlight and natural airflow have been tested and confirmed as beneficial to destroying harmful bacteria specifically linked to respiratory disease. Research shows that lit rooms had half the viable bacteria compared to dark rooms. An article on April 13th showed in a scientific review that researchers revealed the two things every home and office could do to lower the transmission of COVID-19, which was airflow and natural sunlight.